Hello, everybody. You're very welcome to the RCSI Department of Surgical Affairs first information session on applying for specialist registration. Okay, so today we are going to try and cover four main areas. One, the process and timelines for application, the minimum qualifications and experience you need. We'll give you some advice on some common gaps we've identified in applications, and then we'll try and answer some of your questions. So, firstly, the framework for this assessment, right? The requirement for a portfolio pathway is to demonstrate the knowledge, skills, and experience, that's KSE, for specialist practice in Ireland. The framework for assessing KSE will reflect the high-level learning outcomes of the relevant specialty curriculum. In surgery, in surgery, these are the capabilities in practice, and these are known as CIPs. Okay, so to be able to demonstrate how you meet the CIPs that are required for specialist registration, you must be able to demonstrate that you're performing at the level of a specialist, i.e. successfully managing the unselected emergency takes, clinics, ward care, operating list, and multidisciplinary work, while also demonstrating that you hold the generic professional competencies, GPCs, required of all doctors. So within our assessment framework and within the curriculum, there are 5 generic CIPs across all surgical specialties. The first one is a CIP1, Management of Outpatient Clinics. Number 2 is the Management of Unselected Emergency Take. Number 3 is the Management of Ward rounds and Ongoing Care of Inpatients. Number 4 is the Management of Operating Lists. And 5 is Management of Multidisciplinary Working. All doctors applying must demonstrate that they are capable of unsupervised practice in all generic CIPs and GPCs. So you are applying to be a day one consultant. You have to be at that level, okay? So for example, if we take general surgery as an example, at the time of application, you will need to demonstrate that you have the knowledge, clinical and technical skills in elective general surgery as defined in the syllabus. You will also need to have the knowledge and clinical skills to independently manage an unselected emergency general surgical take, and you should also have the knowledge, clinical and technical skills as defined in the syllabus relevant to an area of specialist interest. But you must bear in mind, you are not being assessed on your progress in acquiring these, but that at the time of application, you are competent in all these areas. Okay, so if you go to the Medical Council website, they have quite a detailed flowchart of the process that's involved in application. So we've tried to summarize this a little bit smaller for you and just give you the outline of what it is. So the first this green box is managed by the Medical Council. So we are service providers to the Medical Council. They manage the process. So all your engagements when you're applying will be with the Medical Council. We are just giving a technical opinion on your application. Okay, so if you have a query to the Medical Council, they have a detailed document that they will send you depending on your specialty, which outlines the requirements. You have to then pull your application together, and the Medical Council will review your application to make sure you've hit the minimum requirements for assessment. It's then passed over to the RCSI. We then have 10 weeks to process it, and then it's returned to the Medical Council. Their committee will then review your application or review the responses from RCSI, and then they'll make a decision. And this is a further 6 weeks. So this application process, it has defined requirements that are consistent across all the colleges. It's standardized, and the application pack itself is standardized. So if you look at the RCSI timelines, there's an application pre-check. So once the Medical Council send us your application, we do a pre-assessment check to make sure you filled all the criteria. And this is where we're seeing most of the issues, that people have not completed the application pack in full. It's quite an expensive process when you apply, and we try to make sure that you haven't missed anything. But the onus is on you to make sure you have a complete another pack. And this can take 10 to 12 weeks sometimes to get all the information. Once we accept it, then we've 10 weeks. And the process is we have 2 specialty advisors Firstly, your application will go to an independent assessor who is a practice consultant in Ireland who's aware of the curriculum and the competencies. Independently, we send it to a second assessor or the program director in that specialty, and they again independently assess it. During this period, they usually take 6 to 8 weeks to complete the assessment. Once they submit their final responses, then it's finally and independently reviewed within the college by a board here, and then we send our response to the medical council. The response is either a yes or a no. If it's a no, we identify the deficits and the gaps that are there. But if it is a no, then it's a full resubmission that you actually have to do. So you have to go back through the process. So that's why it's important to make sure when you put the effort to pull the pack together, you actually complete all the requirements and you fully understand them. Okay. So I'm going to pass you now over to Professor Kevin Barry, who's the Director of the National Surgical Training Programme. He's going to speak to you about the minimum qualifications, experience, training and knowledge that you should have when you're applying this process.
Good evening and welcome to this CPD event. My name is Kevin Barry. I am the Director of the National Surgical Training Programmes with the Royal College of Surgeons in Ireland. This evening, I would like to provide some information to prospective applicants who wish to apply for specialist registration with the Medical Council here in Ireland. Upon receipt of an application for specialist registration, the relevant paperwork is assessed by the Royal College of Surgeons in Ireland. And in order to determine whether an applicant will be successful or not, it is important that we have a system to assess the competencies of each applicant. And for that reason, I felt it was important to explain to our audience this evening the various competencies and steps that are required in order to be successfully registered as a specialist surgeon with the Medical Council in Ireland. The Medical Council is the regulatory body in the Republic of Ireland. So the Royal College of Surgeons in Ireland acts as a third party to provide advice to the Medical Council as to whether or not an applicant should be considered for specialist registration. But ultimately, it is the decision of the Medical Council of Ireland as to whether or not an application is successful. From the perspective of the Royal College of Surgeons in Ireland, we have an assessment framework which involves a series of steps as outlined in this slide. So, for example, you will see that there are 4 main areas that require assessment in order to decide whether or not an applicant can be deemed of sufficient standard to be recommended for specialist registration. So my purpose this evening is to carefully take you through that assessment process. And this is divided into 4 individual sections. Section 1 speaks to the specialist qualifications that are necessary in order to be registered as a consultant surgeon. Section 2 deals with the training of a candidate and how that would be deemed equivalent to the training of a higher surgical trainee coming to the end of higher surgical training. Section 3 deals with the assessment of other aspects of surgical training, and Section 4 deals with the professional attributes of a surgeon. So the assessment framework is based on 4 sections, and each of these sections require some explanation in order to give prospective applicants some insight as to what exactly it is that we are looking for when reviewing any application. From the perspective of the presentation this evening, there is a commonality to the assessment of applications for all of the 10 recognised surgical specialties. The particular example this evening is an application assessment form that would be used in the context of somebody applying to become a general surgeon. But overall, there is a great similarity in terms of the assessment process for each of the 10 surgical specialties. What I wish to emphasize under section 1 is that a candidate wishing to be considered for specialist registration in surgery should ideally have satisfied these 4 criteria in order to have a decent chance of meeting the standards for recommendation for specialist registration. So for all of the 10 surgical specialties, we require that an applicant can demonstrate a minimum of 2 years of core or basic specialist training in approved posts. We also require that a candidate has a minimum of 8 years of higher specialist training in approved posts. Then in terms of the specialist qualification that is recognised here in the Republic of Ireland, specifically we are looking for evidence that a candidate has passed the intercollegiate fellowship examination in surgery. And therefore, this is a key requisite for a successful applicant to be recommended for specialist registration. So in the particular example I'm speaking about this evening, I've alluded to general surgery, but for all of the 10 surgical training specialties, it would be necessary for any individual candidate to have passed the intercollegiate fellowship examination in that particular branch of surgery, or the candidate has to provide evidence of an equivalent examination award, which I will speak about on the next slide. As far as emergency experience is concerned, we expect that all applicants will have demonstrated evidence of experience on call. So therefore, we require that all applicants can demonstrate consistent exposure to emergency on call for unselected patients in their specialty. And therefore, evidence of this is required. And such, we would expect evidence of at least a 1 in 8 or a 1 in 10 on-call rota throughout any particular year of training. So these are essential items for a successful application. I mentioned that we specifically look for an applicant to have passed the intercollegiate fellowship examination in whichever branch of surgery they wish to be considered as a specialist. So typically we require evidence of a letter or an email from the Joint Intercollegiate Examinations Office in Edinburgh, confirming that a candidate has passed the intercollegiate FRCS examination in that specialty. And this is to ensure that the candidate can demonstrate that they have achieved the standard of a day 1 consultant in terms of their knowledge and skills. The purpose of this is to make a final assessment and to validate the candidate's training. If a candidate does not have the intercollegiate fellowship examination of the Royal Colleges, alternative acceptable qualifications include fellowship qualifications from other jurisdictions. For example, a fellowship of the Royal Australian College of Surgeons can be considered equivalent, or indeed a fellowship of the Royal College of Physicians and Surgeons of Canada, or a fellowship of the College of Surgeons of South Africa. Similarly, a fellowship of the College of Surgeons of Hong Kong, or indeed a fellowship of the Academy of Medicine of Singapore in surgery. The list of equivalent examination qualifications is maintained by the Medical Council. So we're quite specific in terms of what we're looking for under section 1. And ideally, we wish for the candidate to have passed the intercollegiate FRCS examination in their chosen specialty. And as I said, alternative acceptable qualifications, I've given you some examples there. Moving on to the second component of the assessment process. In terms of a candidate's training and their ability to demonstrate equivalence to the training received by a higher surgical trainee in any particular surgical specialty, this slide outlines some of the aspects of training that we specifically look for. In terms of duration of training, we're looking for evidence of 8 years of specialist training, certification to confirm this, and this should outline the elements of training and the structure and the assessment of training and the syllabus that was pursued. To give candidates some help in this process, it's often very useful to look at the structure of the training programs provided in these colleges and summarized on the Intercollegiate Surgical Curriculum Program website. So, for example, it's possible to log on to the Intercollegiate Surgical Curriculum Program website and to review the curriculum of training for each of the 10 recognized surgical specialties. The curriculum is provided in significant detail on this website, and therefore it gives candidates the opportunity to review the content and the training material and the conditions, both elective and emergency, relevant to that specialty. So therefore, if you're being asked to provide equivalence in terms of your own training, that's a very useful resource in terms of benchmarking and gives you some help in terms of proving equivalence to the content of the formal intercollegiate specialty curricula as outlined on that website. We also require evidence of some management and leadership training. So, for example, you should be able to provide some evidence of involvement in rota administration, being a trainee representative, being a membership of a working party, etc. And as you would expect, it's very important that you provide some ongoing evidence of involvement in continuing professional development. So any certificates that you have regarding attendance at meetings, workshops, or at other events such as local, national, or international meetings, all of this should automatically be part of your portfolio, which will be assessed by the Royal College of Surgeons in Ireland as evidence of your commitment to your professional development. Moving on to the third component of the assessment, we take a more detailed look at the actual training experience, and in particular, we distill down into looking at a candidate's logbook, and we also require evidence of attendance at certain courses. In the example I have put together for this evening's presentation, it's specific to general surgery, but again, the principles are the same across all of the training specialties. In general, we require evidence of a consolidated logbook with a minimum of 1,600 cases to demonstrate evidence of training across the breadth of any particular specialty in both elective and emergency conditions. And this logbook should summarize the variety of procedures that you have performed, and indeed the variety of procedures for which you have been supervised during your training, to give us some ability to determine whether or not your training can be deemed equivalent to that of a higher surgical trainee. So the logbook is also critical to the process, very important, and how it's presented is very important. And there needs to be evidence of progression and assessment and evidence that you had a supervisor for your training. In terms of the mandatory courses that we require, we need documentary evidence of attendance at certain mandatory courses, such as the Advanced Trauma and Life Support course, or ATLS course, the Care of the Critically Ill Surgical Patient, CRISP course. In the case of general surgery, we require evidence of a certificate in training for endoscopy, which can be provided by various different organizations. In the context of a vascular trainee, we require evidence of attendance at a vascular training conference. And for all surgical specialties, we require evidence of leadership skills for surgeons. So, for example, this is provided in the human factors and patient safety classes administered by the RCSI, and indeed some evidence of attending courses and subspecialty courses in your specialty. So this highlights some of the detail that is required to satisfy evidence of experience in the particular specialty that you wish to be registered as a consultant surgeon. Under this particular section, we also delve into some details in respect of other aspects of your training. And while this might appear to be a complicated slide, effectively we need evidence that you have been involved in audit. We have to have some evidence that you were involved in research, and we need some evidence that you were involved in attendance at national or international meetings. In terms of audit, we need evidence that you have been involved in completing 3 audit or service improvement projects. And within that context of evidence of providing participation in audit, we also require evidence that you have closed the audit loop in at least one of these projects. So that's required. With regards to the next circle to my right, with regards to publications, publications are not mandatory, but they are desirable. Ideally, we would like an applicant to be the author of 2 peer-reviewed publications. With regards to presentations, we do require that an applicant is the author of 2 presentations, either oral or poster presentations at national meetings. We also require evidence that you have participated in critical analysis of publications, and the most common way of doing that is to provide evidence of participation in Journal Club. Ideally, we like you to have some evidence of training in research methodology, and we also require evidence that during the course of your training you have attended national and international meetings, and certainly a minimum of 3 such meetings is required. Section 4 of the assessment process looks into other aspects of your surgical training, which come in under the term of professional attributes. So this has to do with other aspects of your surgical training, and this assessment comprises a combination of desirable and required activities. So you will see on this slide that if you have any evidence of previous awards or achievements, while they're not required, they're considered desirable. So if you have any of these, please submit them. If you have evidence of any form of multi-source feedback, please submit same. This would include evidence of participation in a train-the-trainer course or some such equivalent during training. We like our candidates to be involved in medical education and training, so you may be able to provide some documentary evidence of this. And indeed, if you have any other qualifications and certificates that you would like to bring to our attention, please feel free to do so. We also ideally like candidates to be members of professional bodies and organizations within surgery, and if you are, please provide documentary evidence of same. We do require evidence of references from 5 surgeons within your specialty. We also require evidence that you have participated in formal communications classes, such as human factors and patient safety, and we require evidence of your involvement in multidisciplinary team working. So we do require evidence that you have been involved in multidisciplinary team meetings. Ideally, we would like you to be involved in some quality improvement projects. And ideally, we would like to see that you have some evidence of receiving referrals to your practice. In respect of multidisciplinary working, we focus in on your relationships with your colleagues. So we like to see that you have participated in study days, that you have participated in X-ray conferences, pathology meetings, that you have presented at grand rounds, that you have a consistent record of maintaining a portfolio of participation in continuing medical education. We wish to see that you have evidence of formal teaching activities. We would like you to have some evidence of being involved in teaching at least once per month. And this could be in the form of giving a lecture or a tutorial or a bedside teaching event. And we also look for evidence, as I said earlier, of attendance at national and international meetings. And we also look for evidence that you have been involved in some type of committee and that you have attended committees and served on at least one committee during the course of your surgical work. So you can see, therefore, that there's quite a level of detail required in order to satisfy all of these various assessments of competencies. And at the end of the process, RCSI then makes a decision as to whether we believe an applicant should be placed on the specialist division of the register with the Medical Council. So we return the assessment to the Medical Council with a recommendation that either says that yes, the candidate satisfies the criteria and therefore should be considered as a candidate for inclusion on the specialist register, or alternatively, we may give our decision that the candidate is not ready to be placed on the specialist register. If a candidate is not at this point deemed suitable for inclusion on the specialist register, we will provide reasons for this, which are meant to give the candidate help in this area and to provide some constructive advice as to what the gaps are, or what the deficiencies are, or what the candidate needs to do in order to ultimately reach the standard that is necessary. So if a candidate is not considered suitable for inclusion in the specialist register, we will give a detailed feedback as to what it is the candidate needs to consider prior to submitting a further application. So thank you for listening to this presentation, and I hope that this will provide prospective applicants with a level of detail that will help them in preparing their application or their applications in the future. Thank you very much.
Okay, thank you, Professor Barry. So my job now is I'm going to look at some of the common gaps in the applications process. So I'm the Associate Director for Operations and Regulatory Affairs, and it's my team that do the first initial check against the requirements. And this is the feedback that we've got from our consultant trainers and the team internally. So firstly, what I'm going to detail to you here is gaps that we have seen in applications that make it difficult to assess or can result in a negative outcome. The first one is who should complete your structured references. So we asked that there's 5 structured references, and that's the format of it. But a lot of times people do not pick the right people to do their reviews. So ideally what you should have is you should have 5 reports from consultant surgeons who are permanent appointees who have observed your practice over the last 3 or more years prior to your application. At least 2 of your referees should have current or very recent significant involvement in your training and knowledge of the assessment process. For example, they could be your clinical supervisor, assigned educational supervisor, training program director, or equivalent role. So in your post, it's important, particularly we see a lot of people who take on service roles, but they don't have somebody who's teaching them, filling out the workplace-based assessments, or that they've completed a learning agreement at the start of their rotation. I would suggest to everybody is do a learning agreement when you start the job with your supervisor and agree with them what you're going to learn throughout that year. One of the reports that you submit, the references, should be the head of your specialty department in which you are currently working. It's fine using the clinical director, but it's only appropriate it's in your specialty. So that's the first one. Okay. The second issue we see a lot is that the guidance document that the medical council will provide you with, it details the curriculum that you're going to be assessed against. It's the ISCP curriculum. Okay, so you can see it on the bottom left-hand corner here. We've seen lots of applications where nobody mentions it and nobody has aligned their submission to the curriculum. And that makes it impossible to assess because that's what you're being assessed against, right? So what you should provide is a detailed, thorough, and succinct cross-referenced mapping document demonstrating how each and every one of the competencies in the curriculum has been covered in your qualifications, training, and experience, right? The evaluators will then determine whether you have provided comprehensive enough to demonstrate the level of knowledge as into the curriculum. Applicants must be aware that as no other qualifications bar the FRC path are considered directly comparable, this will be assessed on a case-by-case basis. So if you're submitting evidence of a different exam, you need to understand that these will be assessed on a case-by-case, and you need to map out clearly how that exam and your experience makes you equivalent to that of a day one consultant in Ireland that's mapped out in the curriculum. On the bottom right hand, I would encourage everybody to go to the ISCP website. In that, there's a number of helpful videos in there about the curriculum. They also have all the curriculums that you're going to be assessed against. So if you're in general surgery, it's there. So all the surgical curriculums are there. All the documents for workplace-based assessments are there. And they also have a portal that you can pay up to use that is an electronic portal that has learning agreements, has all the forms so that your trainers and supervisors can fill out. But you need to be very familiar with the curriculum on the left-hand side. In this case, I've given you the general surgery one, but also everything in the ISCP portal, because that's what you're going to be assessed against. Okay. We get lots of content sometimes with no descriptors or no reflections. That makes it very difficult to assess. So within the pack that you submit us, there's predefined sections where you have to answer particular questions. Within each section of the structured report, please include a summary of the content and how the evidence you supplied in the section is aligned or mapped to the curriculum. So you should do a reflection on this and clearly map out to it. Giving us lots of documents and forms is no good if you actually haven't given a summary of the content and if you haven't aligned that to the competencies that are in the curriculum. The next one is the assessment and competence, right? So you must demonstrate knowledge appropriate to specialist practice in Ireland. The Joint Committee for Intercollegiate Examinations, JCIE, Special Examination, FRCS, is the one that demonstrates this. So there's a lot of detail on this slide, and we'll provide these slides as part of the course to you. But just in summary, if you do not have this exam, then you can submit alternative evidence, but you will need to bear in mind that this needs to be very strong. You need to demonstrate the evidence of depth and breadth of knowledge. You can provide a portfolio to demonstrate appropriate levels of knowledge in the specialty you're applying for, right? The scope and format of the exam is very important, and it should allow for the testing of the broad range of knowledge. Therefore, the method of testing and the length of the exam parts of the exam is very important. In addition, a test of knowledge / examination should test more than just recall. It should allow for interpretation, decision-making, professional communication skills, and application of knowledge and higher order thinking. So Other examinations, if you are using other examinations and you don't have the FRCS, and we'd encourage everybody who's applying for this to have the FRCS because that's the recognized exam, right? If you don't have that, it's very difficult for you to provide the evidence. But if you are using another exam, you will need to provide certification of success together with details of what the examination covers and to what level. For example, the scope and format of the exam. Most people who provide other exams do not provide this, and that makes it impossible to assess. A certificate of success alone will not show that you are currently have the appropriate level of knowledge. So again, we have to look at these on a case-by-case basis. We are seeing more and more people who are submitting without FRCS and using the European board examinations. The European board examinations are unlikely, even in combination with other elements of their portfolio, to show knowledge as described. And we haven't had a case yet where it does. This is because the scope and format of this exam is different, and that generally it is shorter and therefore doesn't give the opportunity to display stroke test the same amount of knowledge. It tends to test knowledge recall only and not decision making, professional communication skills, and the application of knowledge to a higher order of thinking. The gaps between the European board exams and the FRCS make it extremely difficult for people with that exam alone to actually get through this process. And I'd encourage everybody to consider that in their application. Okay. So the other gap is we see many of you who do not submit workplace-based assessments or do this retrospectively. Retrospective workplace-based assessments carry no weighting as part of this process. Workplace-based assessments are formative, and they're part of your training along your career. So you need to plan for this at the start. Again, if you go onto the ISCP website, you can get access to all the forms. But what is expected is that the workplace-based assessments you complete, and just your trainer completes, are formative. They give you advice and guidance, right? So we would expect that we would have an indicative number of 3 workplace-based assessments performed by different assessors for all index cases. And then for critical case, at least 1 CBD or CEX for each of the critical conditions that are marked at level 4 in the curriculum, all right? An indicative number of 10 CBDs or CXs in your specialist interest area and showing satisfactory performance as well. So each of you would be expected to have a particular specialist interest area, and this is where we need to see your CBDs and CEXs. This is very important. We see a lot of people that will put in 1 or 2 workplace-based assessments that are retrospective, and they're not formative, and they get no weight. Okay, so research. Research is really important, and it gets a lot of people who have been unsuccessful fall down at this area, right? Applications must provide evidence of having met the relevant requirements for research and scholarship set out under GCP 9. It's clearly mapped out in the curriculum. So again, go to ISCP. So broadly, if you're going to work as a day 1 consultant in Ireland, you need to have competencies built up in 4 areas. You need to a demonstration of evidence-based practice, an understanding of how to critically appraise literature and conduct literature searches and review, understanding and applying basic research principles, and understanding the principles of research governance and how to apply ethical guidelines to research activities. At entry to the specialist division of the register, for patient safety, we need to be assured that someone can continue to be able to apply the findings of current research directly to the care of patients to improve their experience and outcomes. This is really important. So how do you demonstrate this? Publications, podium presentations at national or international meetings, not regional meetings. So they need to be at a national or international level. As presenter of full audit cycles at national or international meetings, and confirmation of involvement in national database collections with reflections on personal outcome. The reflections on personal outcome are really important here. So what your evidence should show, So sorry, that's the end of the research piece. So the next piece is on management and leadership. So if you're going to apply to be a day one consultant in Ireland, it's important that you have management and leadership experience. So we would expect to see evidence of leadership and having taken part in management related activities, and evidence of communication, partnership, and team working. All of these are vital to patient safety, but particularly we want to see involvement in clinical governance to delivery within your hospital and providing better patient safety. And this should be at a senior level. So the suggested evidence that we would require here is leadership courses, modules, training courses, or reflection on your management experience. Also, we'd expect to see either completing an academic course or module, and we have management and leadership certificates here available under the CPD-Assess program. It's a 3-day certificate, but we also have some management micro-credential models you could also consider as well. But from your work experience, we would also want to see rota organizations, that you've acted as a clinical lead or senior clinical decision maker, that you've been an audit lead, that maybe you've been a committee chair, you've had and or have educational leadership roles. You should also provide reflection on your management and leadership activities. So this brings it all together. And I've given a link at the bottom of this page to reflective practice toolkits that we would advise people to use. The reflection on your management and leadership activities is really important. It's a summary where you write 1 or 2 pages on that, where you can sync it. We make a succinct summary of your thoughts about your management and leadership experience over your full career. Okay, this is really important as well. So as a consultant in the future, you need to have some form of formal medical and education teaching experience. So we need to understand that there's evidence of your understanding of and practice in medical education. It's in GCP 8, capabilities in education and training. So the assessment requires you to carry out the roles and responsibilities of a clinical trainer and have evidence of that. You must provide evidence of being trained in the training of others. So we would expect to see a train-the-trainer course. So you need to be able to demonstrate that you've participated in medical education and you've got feedback on this, and that somewhere you've got an understanding of educational theory that underpins adult learning, particularly in healthcare if you can. Again, we provide a 3-day certificate in clinical education, but there's other colleges out there to provide the same as well. This is really important. All trainees going through the training programs at the moment do 2 courses in medical education and teaching. And a lot of people who are applying are falling down in this area, and there's lots of courses out there, and the RCSI CPD program has lots of capacity in our courses, and I advise everybody to make sure you do something in this space. Okay, so CPD is really important, and people give us lots of certificates of what they do, but you need to consider this, and it needs to be spread out over your full career. It's important that you can show that you engage in CPD. Surgical practice regularly changes as new evidence emerges, so involvement in CPD is vital to demonstrate currency of protocols and practice in light of most recent evidence. Again, it's really important that at the beginning of this section in the submission, you should provide a reflection on your CPD activity in line with good medical practice. So the other element of this in CPD is fine, but because the nature of surgery is continually evolving, you need to show evidence of regular attendance at national and international specialist conferences. So it is recommended that you attend national and international meetings regularly during the 6 years prior to your application, e.g. annual meetings and national specialty associations or major international equivalents. Again, this is because surgery is continually changing and evolving, and you need to be aware of the changing practices. So that's the last of our guidance on it. These are the main areas where people fall down. But what I would advise you all very strongly is if you're going through this process, it takes a long time and it's quite expensive. So take the guidance we have given you here. We will provide the slides so you can go back through them. But read the curriculum. Go onto the ISCP website, review the curriculum and syllabus and look at it. And if you've taken a different route where you haven't got the FRC pass, or you've had your education and training that's not on a structured training program, you need to clearly map that to the current curriculum so that we can see that you've achieved the competencies that are mapped out in the curriculum. Most people who do not come through successfully in this process make that mistake where they don't link their training and experience to that of the current curriculum and syllabus. So I wish you every success. After this process, we're going to try and get feedback from everybody to see how we can improve this. And we hope that this will be a series of webinars or discussions or videos where we can try and help you prepare better for progression to be a Day 1 consultant. Thank you and good luck with your application.